So I remember at school, one of my favourite subjects was design and technology. The great thing about design and technology is it meant using your hands. And for me as an osteopath, the use of my hands is probably one of the best tools I have. I was also very lucky in that I was engaged very much in the sport of fencing. I remember being in a competition when I was 16 years of age, and we fenced on metallic piece, and unfortunately there was a little bit of grease on the piece. I lunged, I did the splits. Now you can probably imagine men are not used to doing the splits, and as well as being pretty uncomfortable, unfortunately at the time I sustained a very nasty injury. The injury was essentially what we call an avulsion fracture, which is where the hamstring muscle, which is at the back of the thigh, actually physically came away from the pelvis. I was rushed off to A&E. The doctors there x-rayed me, told me what was going on. I got back down to London again, and I had essentially about 6 months of orthopaedic specialists and physiotherapists. Unfortunately, they weren't really able to help. I was very, very disgruntled and a bit angry at sustaining this injury at this stage in my life. But my school very kindly offered to pay for me to go and see an osteopath. Now, I had no idea what osteopaths were in those days, but I was willing to try absolutely anything. I went off with great trepidation to see this guy. He diagnosed the problem, and within 6 or 7 sessions managed to cure me. And I thought, wow, this is actually medicine with my hands. And for me that was the actual start to my osteopathic career. At the time I was choosing my A-level subjects, and obviously I chose the right subjects. I applied to the British School of Osteopathy, which is the largest and oldest osteopathic educational establishment in Europe, got in, and decided to take up my place in 1983, qualified in 1987, and the rest is history. At school, I'd be the boy at the back of the class, and if a teacher asked a question, I would be absolutely terrified of putting my hand up. What was interesting is, as I got into osteopathy and I found my passion and my skill, I'd actually be much more willing to volunteer information. Now, the reason I'm telling you this is when I graduated, I was awarded the prize for osteopathic technique. I was then invited back to teach osteopathic technique, which was a great honour for me. Now, for me, teaching technique was really 2 or 3 important points. One was it would actually make me a much better osteopath. Practicing technique over and over and over again was really important in terms of developing my physical skills. Second part is teaching actually puts you at the top of your game. You've got to keep up to date with current research. And you've also got to develop very good communication skills to be able to get your message across. So I actually thought teaching was not only a good way of putting back into the profession, but actually helping me become a better osteopath. I was also asked to run the multidisciplinary sports clinic at the British School of Osteopathy. Again, because of my background in fencing, I thought actually developing sports injuries would give me great experience and great opportunity. The third aspect that I really got into, again developing the sporting side of my practice, was spending 8 years working for London and South East Division Rugby. This gave me great experience in terms of acute sports injury medicine, which was slightly different to the sort of normal run-of-the-mill stuff you see in normal osteopathic practice. The fourth side of developing my practice was I was very lucky to have been invited into quite a high-profile osteopathic practice in the centre of London. I initially started 3 half-days a week and gradually worked up to being a full-time partner, seeing between 80 and 100 patients a week, giving me great clinical experience. But what was fascinating was, as holistic as it was, for me it wasn't enough. And one of the issues sometimes I have with how osteopathy is perceived is that it's essentially perceived as a mechanical form of treatment. And for me, osteopathy has actually always been a philosophy of medicine. And after 10 years, I was starting to think, I've really now got to go on and make another jump in my development. It was around 1997 where I'd been off to a family holiday in the Caribbean. For those of you who don't know, I'm half Trinidadian, half Irish. Quite an interesting mixture. Anyway, I'd come back from the Caribbean, and being a type A workaholic, I was never used to having any time away from work. And I remember waking up one day feeling absolutely dreadful. We had just got married, we'd had our first child, and my wife said to me, well, it's obviously you've just got man flu. So I sort of thought to myself, okay, well, let's just struggle on. I went into work, and it was very obvious it was a little bit more than man flu. So cut a long story short, I went off to see a rheumatological colleague of mine who started running some blood tests, and it was very obvious that there was actually something quite seriously wrong. I was referred back into the NHS because we live in the countryside, it would be easier to access it. And I went on a 2-month exploration, seeing many different consultants, having a variety of blood tests done. And what struck me really was that I expected medicine to come up with answers, and I was profoundly disappointed when they actually couldn't really tell me what was wrong with me. It ranged from, I think you've got cancer, to some horrible rheumatological condition. And to be honest, I never really got a definitive diagnosis. I was put on a variety of different drugs, ranging from anti-inflammatories, intramuscular cortisone injections, painkillers, sleeping tablets, antidepressants, second-line anti-arthritic drugs. Now I remember vividly being told by my consultant at the time that I'm going to really need to take this cocktail of drugs, probably indefinitely. Now, being trained as an osteopath, I thought to myself, well, this is crazy. You know, there must be a reason why I'd become ill, and I need to really search for a better solution. I was very lucky to have known, and still know, a very eminent psychotherapist slash hypnotherapist called Dr. Brian Rowett. Brian and I first started practice working at a gynecology practice in Kensington. I was the young osteopath on the first floor, and he was the mad psychotherapist on the 4th floor. Brian's a very interesting character in that he's an Aussie Rules ex-professional who became a GP, became an anaesthetist, and as a consequence got into pain management. Now, like a normal doctor, he would give patients drugs or injections. And after several years he said to himself, I wonder what's really wrong with these patients. And he retrained as a psychotherapist, hypnotherapist. I remember one day Brian saying to me, Gerry, I really think we need to have a chat. And I said, Brian, why do we need to have a chat? He said, well, you're not well, and I guess there's going to be another story going on. I saw Brian 3 times, and I won't go into all the details, but one of his techniques is called visualization, which is a very gentle way of using images to access the subconscious mind. One of the vivid memories I have was going into a very minor trance with Brian while I was using these images, and suddenly feeling very unwell. And I said to Brian, do you mind if I stop? He said, no, not at all. So we basically came out of my little trance and we analysed what had happened. And I said I was going round and round in a circle, and if I didn't stop, I was going to get sick. And it dawned on me like a light coming on into my head. Actually, my life was going round and round in a circle, and if I didn't stop, I was going to get sick. And it was at that point I made a decision to dramatically change my practice life. My wife said I was mad, my accountant said I was mad, but I decided I needed to have a much broader view of being able to practice, and I've been quite constrained. And within 2 weeks of making that decision to make those changes, my blood results began to normalise. My consultant said, "Gerry, fantastic, the drugs are beginning to work." And I said, I stopped taking the drugs. Specifically, when we look at blood tests, which I do quite a lot, there's a couple of what we call inflammatory markers, ESR and CRP. Now, I had an ESR at one stage of 120. Now, that probably doesn't mean much to most people, but if there's any doctors in the audience, they'll know what that actually means. What was fascinating is, having made the decision to make changes in my life, my ESR dramatically started to fall. There's no doubt that some of the benefit was obtained from some of the drugs, but I believe the fundamental benefit was changed when I made the decision to change my life. It was at around that time when I was seeing a very eminent general physician in London who very kindly invited me to work in his practice. And I thought to myself, this is interesting. I've spent the past 12 years really working with mostly osteopaths, doing teaching, getting involved with my sports medicine. But in fact, I've now been given an amazing opportunity to really develop my medicine. And I spent 2 years working with this guy, who I have to say, I think is one of the best diagnostician GPs in the UK. And he fundamentally encouraged me to really start using the knowledge that I had obtained both through my undergraduate training and my clinical work and my substantial postgraduate training. And this allowed me to embark on what I call a more integrated approach to osteopathic medicine.